Thank you for joining us on your Saturday morning. I'm going to give a quick talk, a little bit about pediatric radiology. I'm going to need to share my screen. And it truly will be a quick talk. So this is a short introduction into pediatric radiology. I'm a pediatric neuroradiology and a fetal imager. And this is just to give you an insight into all the different specialties and, you know, wormholes that you could enter once you enter into radiology. So is radiology for me? And we'll hear more about all this in this entire webinar, but you know, it's great schedule flexibility. There'll be a session for the women in radiology, plus work-life balance, wellness. People have a perception, and I would like to somehow include the sort of blow that misconception of we are just sitting in a room, in a dark room, isolated, no interaction. But let's talk a little bit more about that. You know, as I said, there'll be a session on work-life balance. We interact with so many specialties, every aspect of medicine, from pathology to all aspects of surgery, primary care. They interact with radiology. There is now, we are at the forefront in terms of the technological advances and also incorporating these technical advances into radiology as a whole. And the main obvious one being AI, you know, and it's always changing. We will be at the forefront of all this. And, you know, some of the other motives that you want to think about, we're not staying late for the extra charting duties after hours. And as I said, this perceived decreased patient interaction. And quite honestly, as a fetal imager, I have a full day of interacting with not just one patient, but the entire family as a whole. And that is inclusive in pediatric radiology. And there's good compensation in radiology too. So what we do, we typically read as a diagnostic radiologist, you can read, you know, up to about 100 exams a day, work, you know, a good number of hours, but there are good balance in terms of having good times off, and you get compensated for days off. There are different responsibilities in terms of private versus academic, and you know, that's a personal choice, and it works for the majority of people. And I think people naturally go into whatever route that works for them, the majority being private, and you get great compensation for that, a lot of time off. But but they have a different emphasis on the work-life balance there. What are the modalities? We read everything in radiology: X-rays, ultrasound, fluoroscopy, and there's like great interaction. You're actually doing the procedure and then reporting it. CT and MR, I have interaction with the clinical care team because, you know, nowadays there could be very sick patients that you have to be at the scanner for and make sure that everything goes right. You're interacting with all the team members there, the nurses, the anesthesiologist, your techs, your CT or MR tech, and then nuclear medicine also is a big part of radiology. And in pediatric radiology specifically, kids are not just small adults. And you know, my day is so great and interesting. It's not the same old. We have different pathologies compared to adults. And you know, when kids get sick, they really get sick. We have great relationship with our pediatric colleagues, and again, all specialties across the board. And you know, our colleagues and referring providers commonly seek us out to review cases with us, and not just in conferences. So this is just a quick review of like, one of the three key aspects of points of why choose pediatric radiology. Where as a radiologist, you're integral part of the pediatric clinical care team, and that includes general radiologists, MSK radiologists, fetal imager, pediatric neuroradiology. We are highly valued, subspecialty. And then even in pediatric radiology, you can subspecialize, which I have done so. And it's the norm to interact with our family and with the kids. And ultrasound, pediatric ultrasound, is another area of interaction. If your technologist is having difficulty, then you have to get in there and try and get the diagnosis. So here's just a few sort of photos of exactly what I've said. The sort of ultrasound, hands-on ultrasound in pediatric radiology, and also as a fetal imager, I will routinely scan our pregnant mothers. Then the fluoroscopy, you have interaction with that, and not just the mom or the dad, but also kids of varying ages, even teenagers. They some are scared to be at the hospital and at the sort of conventions. And then we have special days, Halloween days as one of them more recently. And just as a quick view of some of our procedures, fluoroscopy, upper GI, interception reduction, and now a little bit more at the forefront, contrast enhanced ultrasound also. And we get interesting diagnoses, kids swallowing various things. You turn and suddenly they've swallowed magnets, they've swallowed batteries, and which are kind of dangerous and really quite emergent. And as what I see are, brain, head, spine imaging of kids, babies, newborns, and then the further subspecialty, fetal imaging, brain and body. We are very comparable compared to all other specialties. Here's a specialty salaries that was published on Medscape. We are on the higher end of the spectrum, and getting there, and we'll learn more about it. Med school, internship, diagnostic radiology residency, and then further subspecialization, fellowship, whether it's pediatric radiology, MSK, women's imaging, breast imaging, and then attending. These are sort of the various like qualifying steps. And there's going to be exams in all specialties, as well as continuing medical education, whatever you choose. So and then let's not forget, we cover every aspect of the body, cardiac radiology. And someone mentioned in the chat box, research. So research will be important when you're applying for academic programs. And most radiology residents do not do a lot of research in residency. But what I want to say this is, in terms of research and how you build up to the higher end research, it's a long road, and I've had to learn through, as a med school residents, all the various skills. You might not necessarily be in a large like grant research project as a radiology resident, but whatever aspect of research you are involved in, or you get involved in, whether it's a retrospective chart review, an educational poster, every aspect that is important, because you will learn the skills that you build on and be used to get larger and larger research projects. So you know, it's just like anything. You have to learn all the skills behind it. And this is a little show on the future and now. You know, what radiologists as a whole we're involved in. 3D printing, that is good in terms of giving true visual, especially for our clinical colleagues in, again, every aspect of radiology: cardiac radiology, neuroradiology, craniofacial for the plastic surgeons, artificial intelligence, that's coming down the pipeline. And even now, it's being used in, you know, part of it's being used in breast imaging, such as CAD. And this is not going to take the human factor away. It's going to improve and help us as radiologists. All the different image post-processing techniques. There are advanced imaging techniques, especially in things like neuroradiology. And I'm talking things like, I don't know if any of you heard of diffusion tensor imaging, functional MRI, non-contrast perfusion imaging. That all needs high-end post-processing. And we need technologists also to create these beautiful 3D rendered images here that you can see on the far right. And informatics is also a big thing that's coming in down the pipeline for radiology. Pediatric radiology and radiologists, we are all valued members of the overall care team. Everyone's appreciative of us, every aspect of the hospital and the private system. We radiology touch every specialty and every area of medicine. And because we read all the modalities that is involved in all body systems, whether it's the adult or the pediatric sector. And, you know, and once I think, you know, one thing I love about being a pediatric radiologist, it's very fulfilling. The kids, we do it for the kids. Our kids and they get better, and we want to make a difference for our future generation. So if there's any question for me, here's a quick display of my email. And then let's get back to my colleagues. And if any of you have any questions, happy to answer them now, as we have a few minutes before we go into our next session for meeting with the program directors.
Thank you, Jessie, for sharing what a life as a pediatric radiologist is. And thanks to Society of Pediatric Radiology for funding this session. Anybody who has questions, like if people are like debating between like, should I become a pediatrician or a radiologist, like this is a good middle ground where you can still see the kids and also be a pediatric radiologist, which is amazing, which you still get to see the kids and also treat them through radiology. Like you have interventional pediatric radiology as well, as much more subspecialization if you wanted to.
Absolutely. And as there's no question, I wanted to give this as a general overview of pediatric radiology, but in pediatric radiology, there are like subspecialization and even sub-specialization. So I didn't want to overwhelm people. So, I've subspecialized. So I came from like radiology, so diagnostic radiology, did a little bit adult work for a very short time, then did further subspecialization, so fellowship in pediatric radiology. And then I further subspecialized with more fellowships with, pediatric neuroradiology. And I've done a bit of MSK, pediatric radiology. So I've started off as a pediatric body imager combined with pediatric radiology. So that gives you a very good like variety. So I get good variety of the day. And then after a few years in, I found my more love and passion. I love pediatric neuroradiology. And then from that, actually, I've discovered my other passion, which is fetal imaging. So opportunity came along as an attending, and I did some sort of, further subspecialization training on the job. And so I did, so now I'm a fetal imager and a pediatric neuroradiologist. Every day is different. Every day there are different interaction, different pathologies, and different modalities that I deal with. So every day I don't get stuck in a rut. And there's also crossover because I have experience from the pediatric radiology fellowship. I am very comfortable reading a body issue with a fetal case.
We have 2 minutes left, but we have 3 questions, Jessie.
Yeah.
So one question is from Hari. Is there any aspect of continuity of care for patients as a pediatric radiologist? And then another question is, you talk about pediatric patients and how fulfilling is that there is largely an ability to get better. However, for pediatric patients that you read a terminal diagnosis, do you ever deliver the bad news to the families, or is that something the referring physician does? And one last question is, I think you touched on this, but what are the typical and variety of cases you see from Andrea?
Okay, so continuing care. So as a pediatric radiologist, yeah, I'm involved in, so once you start the diagnosis, they come in, they're in ED, and then we know, if it's a cancer or something like that, then they need further imaging. They need full imaging, and we know the hemonc team will be coming to us to get for the patient to get full assessment for if there's any further spread. Then the cases will get discussed in conference to discuss, the prognosis and what are the possible differential. And unfortunately, we will see them, time and again. But if they get better, also we screen these kids if they have a certain diagnosis, such as, for example, Beckwith-Wiedemann syndrome. These kids need regular screening annually, and even entities such as tuberous sclerosis, they need screening on a sort of 6-month annual basis, or even more benign entities such as a pineal gland lesion that is more larger than it's not, and it's asymptomatic. These need to be looked after. So depending on where they come from, like if they're being referred from a primary care doc, then I'll mention that they need referral to X, and it's recommended that we screen them 6 months initially, then every year, to make sure that there's stability. So we are, and also I've had cases where it's unknown because it's such a mild form of a disease that families are not aware. And so we, as the pediatric radiologists, we make the initial diagnosis, and then they get the genetic workup, things like that. So we are a core as a radiology specialty. I think we are a core and integral part. What else?
Yeah. And Dr. Susan Hobbs shared her experience and she mentioned the interaction with the specialist in helping teams decide on next steps is always rewarding in helping the children and the family. Thank you, Dr. Hobbs.
And then just one thing I want to mention in relation to Heather's question, do you ever deliver bad news to the families or something, a referring doctor? Typically it's the referring doctor, but I have to say, I work very closely with my referrers, my clinicians, because it depends on their relationship, and it's all our relationship. We have to be cognizant. For example, if the referring doctor is in a satellite clinic, and I've had this, and the patient and the family is on the table on the MRI scanner, then and they can't get to the family, then I discuss with them, like, do you want me to deliver the news to them, especially if it's an emergent piece of information that they need to be immediately changed from an outpatient to an inpatient. So those are the times when I will be involved, but I work closely with my referring doctors as to what their wish is. And I would say that's the same with the specialty surgeons too. Like, they will work with, and I give a case in particular in my practice as a fetal imager. Because it's a larger team. Then there's the OB-GYN, the referring OB-GYN team, the MFM, me as a fetal imager, then there's the fetal surgeon. So who delivers the news? We have a team huddle and figure out what the best next step is for the family and for the mom.